Doc, while selecting access control mode in ventilation, which one should we choose? Either it's volume control or pressure control. So if you choose your volume control mode, we select a particular amount of tidal volume that should be delivered to the patient. So here, the volume of air will be constant. However, the airway pressure will vary depends upon the patient's lung compliance or airway resistance. Whereas in pressure control mode, you select a fixed pressure that should be delivered to the patient. So here, the pressure will be constant. However, the amount of air that will be delivered will vary. Okay, got it, but when to use which modes? To understand that, tell me the formula for the lung compliance. Compliance is equal to change in volume divided by change in pressure. Very good. So compliance is directly proportional to the volume of air and inversely proportional to the pressure. So when the lung is very stiff or when the compliance is very poor, high amount of pressure is needed. That's why in conditions like ARDS, where the lungs are very stiff, airway pressure is very critical. That's why we choose pressure control mode. Whereas in post-operative patients or patients with stable lung mechanics, we need precise control over tidal volume. So we choose volume control mode. Okay, but what happens if I select volume control mode in ARDS patient? As I said, in ARDS, lung will be very stiff, right? So if you select a volume control and if you fix a particular volume, ventilator will generate enormous amount of pressure to deliver that particular volume of air. It may result in damage to the lungs.